Gastric lavage, called stomach pumping or gastric irritation, is a process of cleaning on the content of the stomach. It was first used in 1790 by the English surgeon John Hunter. More effective for a liquid poison or small pill fragment than for an intact table. Although once used very commonly, it has fallen out of the favor over the past 15 years. It is rarely recommended now, but may be considered in important cases. Indications: patient comes very early, within 60 minutes of ingestion. Poison is either absorbed or passes to intestine after this period. Very large ingestions, massive aspirin overdose, very dangerous ingestions for medical legal purposes. Collection and examination of gastric contents for identification of poison for purely legal purposes to recover the packets of narcotics from body packers. In non-poisoning cases, hypothermia. The patient is unconscious, a cuffed endotracheal tube should be inserted first. A double lumen esophageal tube or modified Sungus-taken tube should be used for gastric irrigation with a normal saline, warm saline. Temperature of irrigation fluid should be around 45 degrees Celsius. Heat stroke, iced. Gastric lavage has been tried in a dog model for the treatment of a heat stroke. Disadvantages. That is may delay administration of activated charcoal, which is a more useful procedure. May push tablets further into the GI tract. In general, gastric lavage is better than emesis because of more discomfort caused by to the patient in vomiting. Procedure: tube or revolved tube devised by Karl Lavage, German gastroenterologist. Boas tube, SMR Boas, a gastroenterologist. Ehrlich tube devised by Lavage tube. Evalved tube was commonly used, but now Lavage recommended Evalved tube. The standard Evalved tube is 1 centimeter in diameter, 150 centimeter in length, with a funnel attached to the one end. The other end is round. With lateral openings are there. There is a mark 100 centimeter from the funnel end and 50 centimeter from the distal end, indicating the level up to which the tube should be introduced. Suction bulb. At about mid part of the tube, there is a suction bulb which is used to pump out the stomach content. A wooden mouth gag. This comes along with it. It has a hole in the middle to allow passage of a tube through it. One end of the gag is pointed so that it can forcibly inserted by the side of the mouth in uncooperative patients. Size comes on different sizes, which are measured by F scale. F stands for French scale. Each unit on the French scale measuring 0.3 millimeter. Largest orogastric lavage tube that can be reasonably passed should be used. 24 orogastric tube for toddler, 36 for an adult, 40 for an adult. Ehrlich tube, which has one wide bore lumen with 4 openings near the closed distal tip. A funnel or syringe can be connected in the proximal end. Lavage from lavage and evacuator is a double lumen stomach lavage evacuator made of special transparent polyvinyl chloride PVC, which reduces risk of trauma to mucosal surface. In India, however, the common Evalved or Boas tube is very commonly used. The position of the patient. The patient should be on his left side or a prone position, with the head hanging over the edge of the bed face down. The patient is kept in Trendelenburg position. Mouth is at a lower than the feet to prevent regurgitation of fluid leaking out of through the sides of the tube. Face is supported by an assistant. Trendelenburg position was first advocated by the German surgeon Friedrich Trendelenburg. Classic Trendelenburg position of the feet are higher than the head by 15 to 13 degrees. Introduction of the tube. If dentures are present, they must be removed. Wooden mouth gag is placed in between the teeth and so teeth do not bite tube. End of tube is lubricated with a glycerine, olive or sweet oil or paraffin. Tongue is depressed with a tongue depressor, 2 fingers. Lubricated tube slowly passes downward through the pharynx and esophagus into the stomach till the 50 centimeter is reached. Mark is reached. If there are no marks on the tube, measure distance between the bridge of the nose and the tip of the process. Tube is passed. It should be passed for the same distance. Precaution: do not use words. Conformation of tube in the stomach. Absence of coughing. Absence of coughing and of breath sounds in the funnel tube. Funnel tube will confirm that the tube has not entered the trachea. In case of doubt, insert free end of the tube just below water surface. Just below water surface. Air from the stomach is usually expelled completely 2 to 3 expiration. Air from lung causes a bubbling at each expiration. Lavaging the stomach. Preserve first sample for chemical analysis. Pass about 250 cc of plain warm water through the funnel. High yield above the head when funnel is empty. Pinch a tube below the funnel between between finger and thumb. Lower it below the level of stomach. At least finger and thumb to reach the blockade. Contents will be emptied by a siphon action. Preserve the samples for chemical analysis of all case of poison, suicide, homicide, accident, whether the doctor is government or private. Information to police. Precautions: stop the procedure if there is any bleeding. Subsequent washing with the Lavage fluid, normal saline, 50 to 100 ml in young children and 50 to 200 ml in adults. This then introduced on any other suitable lavage brand lavager. Indications: solution used for gastric lavage against different poison. Solution: calcium gluconate, lactate, calcium salt, oxalate. In oxalate poisoning, this solution is using castor oil and warm water, or castor oil with warm water in carbolic acid or phenol poisoning. Copper sulfate solution used in phosphorus poisoning. Resveratrol 2 gram in 1 liter of water in iron poisoning. Hydrogen peroxide in cyanide poisoning. Potassium iodide in general. Potassium iodide 1% in general. Potassium permanganate 1:5000 in oxidizable poisons, alkaloid, phosphorus, salicylate, saline. Any unknown poison, saline. Saturated lime water general. Sodium iodide 1% general. Sodium thiosulfate cyanide. Starch solution iodine. Tannic acid general. Okay. Indication to stop lavage, gastric lavage. Stop when the returning fluid is clear, odorless, and is of the same nature as the fluid introduced. Indicate that there is no further interaction between the poison and antidote. In case of potassium permanganate, returning fluid is initially colorless because potassium permanganate oxidizes poison and in the process itself gets reduced to colorless compound. Lavage should be stopped when the returning fluid has a pink color of normal potassium permanganate. Poisoning having enterohepatic circulation. Morphine, heroin, about 250 to 300 cc of potassium permanganate. Some other suitable antiactivated charcoal suspension 1 gram per kilogram must be left after to take care of the poison being actively secreted in stomach later. In poison having enterohepatic circulation, gastric lavage is recommended if the poison was administered apparently. Late gastric lavage useful in poisoning causes decreased gastric motility. or pyloric spasm. Antihistamines, tricyclic, antidepressant, phenothiazine, morphine, antihistamine, salicylate, pylor. And a poison which can cave together forming a duffy mass. Just sticks to the stomach called salicylate. Contraindication. Absolute contraindication is must not be done under any circumstance, and relative should not be done normally but may be done after taking precautions. That is absolute corrosives because of perforation. Exceptions are organic acids like carbolic acid, the acetic acid. If the patient is early and corrosion of stomach wall is not great. Okay, exceptions are organic acids, carbolic acid, acetic acid, and oxalic acid. Okay, if the patient is seen early, corrosion of stomach is not great. Non-toxic injections, sharp and pointed material injection, pins and needles, glass risk of perforation is there. Okay, relative. Okay, the non-toxic injection and sharp pointed material risk of perforation is there. Okay. The stomach, because this carbolic acid forms the stomach wall become thick and leathery. Okay. Relative contraindications is a cardiac dysarrhythmia, children below toddler age group. Relative contraindication because stomach wash tube is too thick can be done with a Rayleigh tube or a number 10 to 12 French catheter, because protective reflexes, airway protective reflexes are suppressed, may cause aspiration. Can be done with a cuffed endotracheal tube. Please, convulsion, poisoning, strychnine, because it can exacerbate convulsion. Convulsion need to be controlled first. Esophageal varices for accidental rupture. Hemorrhagic diathesis, that is may cause bleeding, hypothermia, body temperature should be careful attention. Kerosene poisoning, aspiration of kerosene in the respiratory setting, fulminant chemical pneumonitis can be done with a cuffed endotracheal tube. Later arrival of the patients, generally after 3 years, recovery of poison is none or very little. Poison in which late gastric lavage is usual. Poison which causes pyloric spasm or reduced GAT motility, anticholinergic, morphine, tricyclic antidepressant. Poison which a cake together forming a thick mass, that is a salicylate. Poison having an effective antidote. Pregnancy. An advanced intra-abdominal pressure may harmful for child. Surgery, risk of opening up sutures or internal external volatile poisons, that is gasoline, lighter fluid. Can use cause aspiration pneumonitis. Use a cuffed endotracheal to prevent aspiration, vomiting, poisoning already explained. Complications. That is aspiration pneumonia most dangerous. It can occur. Administer hydrocortisone 3 to 4 milligram per kilogram IV, oxygen, broad spectrum antibiotics, bradycardia, cardiac arrhythmia, and cardiac systole due to vagal stimulation and hypoxia during gastric lavage. ECG changes, ST elevations, epistaxis, hypochloremia, hyponatremia, hypoxia, hypercapnia, laryngospasm, Mallory syndrome, that is esophageal tear, mechanical injury to the throat, esophageal stomach, metabolic alkalosis, perforation. Water intoxication. Okay, thank you.